Why does hair fall happen? Why should somebody develop baldness but somebody else just has hair loss and it improves? Why? How do drugs work? How does transplantation work? These questions are frequently asked by patients. To give this information, I am Dr. Venkataram Mysore, dermatologist, hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Bangalore, Cunningham Road, Bangalore, presenting this video. Now, to understand the mechanism of hair loss, first you have to understand what is called a hair cycle. Now, as you all know, hair is one of the few organs of the body which can grow, and in the scalp it can grow long also. How does it grow and why does it fall? This happens because there is what is called a hair cycle. Hair can grow, in the scalp it is 1 centimeter a month. Then it stops growing and stabilizes, rests for some time. Then after some time it falls. Then it regrows again. When we say it falls, only the shaft falls, not the root. Root will be there. It is like a tree losing some leaves and then regrowing them again. This cycle keeps repeating. The duration of the cycle varies from area to area. On the scalp, the growth phase happens for 3 to 5 years. So that means if the hair grows 1 centimeter a month, the hair can grow 35, 40, 50, 60 centimeters. That is why it can grow so long. On the eyebrow, on the other hand, it can grow only for 1.5 to 2 months. So only this much. Mustache, it can grow 8-10 centimeters, 8-10 months. So it varies from area to area. Then, once it falls, it takes about 3-4 months for the root to produce a new hair. There is a lag. Then it grows 1 centimeter a month to start growing once again. This is what is called normal hair cycle. And as a result of this cycle, some hairs fall every day, which is up to about 60, 80, 100 a day. Because in the scalp, there are about 100,000 hairs, out of which 90% is in the growing phase, 9% is in the resting phase, 1% or 1,000 is in the falling phase. 1,000 doesn't fall, 80, 100 falls. On a day you take head bath, another 30, 40 can fall. This is what is called normal or physiological hair loss. Now let us go to pathological hair loss or disease-induced hair loss. In this there are two categories. Temporary, which is due to a change in the hair cycle. The hair stops growing and so it falls. The other one is permanent, which is due to damage to the root. Now in temporary hair loss, what happens is the growth phase gets cut short. Instead of growing for 3 years, it will grow only for 1 year. This happens after delivery, injury, fracture, accident, operations, any fever, whether it is malaria, typhoid, chikungunya, dengue, and our COVID. In the last 1.5 years, 2 years, lots of people have come to us post-COVID hair loss. Not at all surprising. As I mentioned, any fever can cause hair loss. COVID is special. You receive a lot of drugs including steroids. There is a cytokine storm with lots of chemicals being released in the lungs and body that causes hair loss. And the stress of COVID, isolation, quarantine, uncertainty, lack of human contact, all this will contribute to hair loss after COVID. But all these types are temporary. They will respond in 2 to 3 months to simple treatment, to some peptide lotions, some vitamin capsules, iron capsules, proper protein-rich diet, which means all types of chicken, mutton, fish, egg, and for vegetarian, soya, mushroom, nuts, pulses, sprouts, all this contain lots of proteins. So once these are done, it usually subsides. This is also the reason why often people tell us, sir, I went to America, that water didn't suit me, I lost hair. Somebody who comes from America to India, sir, I never had anything there. Here, this water is not suiting me, so I'm losing hair here. It has got nothing to do with water. You have shifted place, you have different environment, different type of food, variation from day to night time, and stress, and that will cause hair loss. And not just America. Somebody who goes from here to Gulf, they will blame the water there. Somebody who comes from Gulf to India, they will blame the water here. So this is temporary hair loss. Then in the permanent hair loss, what is the mechanism? There is a genetically mediated weakness in the root. What do you mean by weakness? Weakness means normally there are certain receptors on these hairs to which the male hormones, testosterone and its cousin, dihydrotestosterone, they come and attach. That is how they work. Here, these hairs are susceptible for this attachment. And so the roots become weak. And that happens because there is a family. But it is important to understand here, it is only hairs in this area which are having this weakness. The same male hormones which cause loss of hair here cause growth of hair on the beard. That is how men grow beard. So the same hormones have different actions on hair in different areas. So in those with the gene for male pattern hair loss, or what we call androgenetic alopecia, the hormones cause hair loss here, but this hair is unaffected, occipital hair. So when we do transplantation, we take this hair. Now there is one more question which is very frequently asked. Doctor, my grandfather balded at 60, my father balded at 55, this fellow is balding at 20, 22 only. Why? Very important question. This is a fact. Young people are balding at younger and younger age. I have been doing hair practice for nearly 30 years. I had rarely seen young people at 20, 25 balding in those days. Now I am seeing 15, 16-year-old boys developing thinning of hair. That is happening because of modern lifestyle, what is called metabolic syndrome. People are developing heart disease early. You have seen film stars dying. People are developing diabetes early. People are becoming obese early. These factors are responsible for hair loss also. Now, how do drugs act? You say it is genetic, then how will it act? Very simple. We have two drugs. One is called minoxidil. This drug increases the blood supply, increases the metabolism of cells to promote the growing phase of hair so that the hair starts growing better and better, and it cuts short the resting phase so that it starts coming back once again. That is minoxidil. It is available as a lotion. It is available as a tablet. Now finasteride and dutasteride, these are the tablets. How do they act? They act specifically on the basic problem in male pattern hair loss, which is the genetic mediated, androgen mediated weakness in the root. Because of this androgen, the hair root is becoming weak, the hairs are becoming thin, and then they disappear. So it will stop that action. It will prevent the androgen from attaching to that receptor and thereby protects the hair. It is more a drug which protects the hair from the harmful effect of the hormone. It doesn't decrease the hormone, so don't be worried that you will have sexual side effect. It only makes sure that the hair is protected from the hormone. This action is specific for the hair. That is why finasteride is called selective antagonist. And it is a very good drug. But because it is supposed to block the effect of male hormone, people are somewhat afraid apprehensive that it may produce impotence, ejaculation defects, semen problems, etc. But that is not necessarily true. It's quite a safe drug in our experience, and we are very good in giving it. Now, there are a couple of other treatments apart from this. One is the regenerative treatment, which is platelet-rich plasma and stem cell, and then the surgical treatment, which is hair transplantation. Now, people say, sir, you say the hairs are weak genetically, then how will you take the hair from here and put it? Simple. I explained to you that the male hormone acts differently in different areas. So this hair is not androgen dependent. Androgens have no action here. So even when we take from here and put it here, those hairs will grow. So they are called permanent hairs. So we take it for hair transplantation. You may look at people who are 60, 70, they will still have hair here. That is why it is called permanent hair. Then what about regenerative treatment? There are basically two types. One is the platelet-rich plasma, which is certain growth factors which are necessary for the growth of hair, taken out from cells called platelets in the blood. It's a simple half an hour treatment. We draw your blood, there's a laboratory way to isolate the growth factors, then we inject it here. It has become very popular. People come, sir, I want to do PRP. It is also one of the most misused treatments. Let me explain to you that this is a simple and safe treatment, but it works as a second level treatment, not first level. Second level treatment along with medicines. It has not been shown to work by itself very well. So it should not be misused that anybody and everybody should do any number of sessions because it's a costly treatment. And other one is stem cell. This again is a much maligned and misused term. People are wanting to use stem cell all the time. We can either take it from fat or from hair itself. This is still in experimental stage. We will have another video to deal with this problem. It is not a routine treatment as of now. It is an experimental treatment. So please be cautious. Don't do something just because somebody else says something. Don't get minoxidil from Amazon and start using. Don't go to some quack and start doing PRP. Don't do such things. Go to a trained doctor. Hair loss treatment is not an easy treatment. Half the world is bald. That only shows that it is difficult. So go to an expert surgeon, expert dermatologist. In our center, we have me, I'm a dermatologist. Dr. Aniket is cosmetic surgeon. Dr. Diksha is head and neck surgeon. So you get a wide variety of opinion. We have other dermatologists also. So that is what is important. Proper analysis, diagnosis, and then treatment. Not a casual treatment. Hair loss is not a casual treatment. It's a long-term treatment. It takes several months to years. So it should not be taken casually. I hope you have liked the video. If you have liked it, please tell your friends. If you want more such topics to be discussed, please let us know. Visit www.venkataram.com and our YouTube channel. Take care. COVID is still around. It is raging. Take care. Thank you very much.